very excited that our feature presentation will be on the Byrne JAG and Byrne SCIP grants. And these are how to work with state administering agencies. Excited that Elizabeth Pike, who's the Director of Government Relations for the National Criminal Justice Association, will be presenting, along with Dr. Matthew Lund, who is the Director of the Division of Criminal Justice for the Colorado Department of Public Safety. So excited to see their presentation. Now, this is, when we send out a link about the 988 Crisis Jam, this is what we provide at NashKid, because you can register for the Crisis Jam, you can see what's coming up, you can see the videos and materials from the past. It is all right there. Please, if you are on YouTube right now and need to register, know there's a vetting process for that. So this has the latest and greatest information. Great, next slide. Now this is, I love the feature on the 988 Crisis Jam that talks about the latest crisis news. So this is postings about activities that happened on 988 day, which was September 8th. And so you can hashtag 988 day and put up any kind of posting that you would like, or to view any of this about activities that you probably did or didn't do on 988 day. All right. And that is in the chat. You can see that. Okay. This is very cool. USA Today reported on the Surgeon General's advisory about how parents are stressed and kids are depressed, and what the Surgeon General recommends and prescribes. And we're looking at taking care of oneself, having open conversations, communication, connection. And that conversation happened also with Matthew McConaughey, and really talking about the importance of connection. Sorry for my phone. All right, so check that out. Moving to the next. Right, and this is an article done by Dr. Anita Everett, who is the director for the Center for Mental Health Services at SAMHSA. Before 988 Day, she put this out, and it's about no judgment, just help, what you can do to support Suicide Prevention Month efforts. And so there's all kinds of resources in there. So we invite you to check that out. Great. And there's a link in the chat to go take a look. And Dr. John Draper, are you on? We're going to be doing the Crisis Trivia Hot Seat. Now, for those of you who have not been on the Crisis Trivia Hot Seat before, or you haven't seen this before, it is exactly what it looks like. It is a trivia hot seat. Somebody is on the hot seat and we ask them questions. We usually have a poll that comes up, but we're not going to do a poll today, John. We're not.
All right. So I'm not getting any help is what you're saying.
That's right. Because if you don't know this, you might not be listening to yourself. So I wish you luck, and I hope your memory is sharp, but I know it is. All right. So in last week's Crisis Jam, Dr. Richard McKeon, he is with SAMHSA, quickly showed 3 paper documents. These landmark research studies from the 2005 to 2010 timeframe improved consistency and practice across the network. Their key focus areas are below. What were these 3 policy/toolkit documents? Now, do you remember what they were, John? Because you were on a podcast where you talked about them with David Covington, right?
Sure.
Like yesterday.
Sure.
Right. Okay. All right. So Dr. Richard McKeon's 3 landmark crisis research studies/toolkits, 2005 to 2010 from SAMHSA, Lifeline Effectiveness Research. What were these 3 documents? And if anybody else wants to take a guess, even if it's one of them or all 3 of them, please go ahead and put them in the chat. But John, you are not allowed to look.
No, these were quite memorable moments for not only me, but the entire network. of crisis centers. The quality studies were actually, they went up from 2001 to 2003. They were completed in 2004, and they were done by Doctors Gould and Califat, who studied specifically the outcomes on crisis hotlines, and Dr. Brian Machar and his team from Quebec that focused on the processes of crisis line services. Those were critical beacons that provided us with the information that led to the standards and policies that you're about to see. The standards were the standards for risk assessment. We found that, sure, we had a lot of good news that, in fact, we were reducing distress and suicidality among callers, but we also saw that we were not doing a great job of assessing for risk. So that meant that we needed to establish standards for the assessment of suicide risk for callers and implement those across the network so we could have a more uniform practice. And speaking of uniform practices, we also determined from those earlier studies that we were not doing a uniform job of responding to people at highest risk of suicide, which is of great concern for many reasons for a suicide prevention lifeline. So based on an assessment for a person at higher risk, what do you do? Well, number 3, that's the policy for helping callers at imminent risk for suicide, which was the first policy of its kind nationally to be implemented for suicide prevention services. We've been building on that ever since, but pretty much the basic tenets of active engagement, collaborating with a person, is the best way to prevent suicide, because only they are going to prevent their own suicide. So we need to do whatever we can to work with them to prevent their suicide. That suicide risk assessment standards, the imminent risk principles, all of those, I think, are really important for us to hold near and dear to our hearts as we study what works in suicide prevention.
John, you blew me away. Not only did you not know what this question was going to be, you went into so much depth and a deeper understanding, helping us deeply understand what this process has been. Really appreciate your knowledge and your sharing. And obviously the way you were sharing it, you have so much caring and compassion behind that, not just the brain knowledge. So thank you for all of your work and leadership.
Well, my pleasure, Megan. And thanks to all of you at Crisis Jam and all the folks who in the Lifeline Network who participated in these evaluations and participated in the development and implementation of these standards and policies.
Wonderful. Thank you so much. Thank you. All right. So let's move to the feature presentation on Byrne JAG and Byrne SCIP, working with state administering agencies. We have Elizabeth Pike, who's Director of Government Affairs for the National Criminal Association, and Dr. Matthew Lunn, Director of the Division of Criminal Justice for the Colorado Department of Public Safety. And this is about cross-sector collaboration to advance crisis response. I'm going to hand it over to Elizabeth Pike. Thank you so much for being on.
Oh, thank you so much, Megan. We are really, really glad to be here. I appreciate the invitation a whole lot because we want to talk about collaboration for all of you with the state criminal justice agencies. First slide, please. So we at NCJA are the membership association of the state criminal justice planning agencies that are known in the federal grant making world as the state administering agencies, or SAAs. We are also pleased to be the Department of Justice's TA provider to these agencies about the Byrne JAG and the Byrne SCIP programs, which are the two grant programs that we're going to talk about today. Next slide. So very briefly, because Matt will go into this a little bit more, the state administering agencies are the state agencies that run the Department of Justice's state formula grant programs. And in this way, they work across the justice system to address a range of top priority public safety in their states. They also advise their governors on justice policy. And in the chat, we will put a link to the directory of the SAAs for you to be able to use in your work. Next slide, please. So we always say at NCJA that when you've met one SAA, you've met one SAA. And that's because, you know, in the typical laboratories of democracy, they are different in every state. They're differently located. Some are independent state agencies. Some are in the governor's office or in the Department of Public Safety. They have different budgets, different sizes, but their common denominator is that they all fund this Byrne JAG and the Byrne SCIP programs, as well as a lot of the other formula grant programs. Together, they administer about $2.5 billion in Department of Justice grant funding and considerably more in state grants that their governors or legislatures have given them to do. Next slide, please. I put in this graph that just shows their self-described role in state government and the policy priorities that their governors have given them. But very notable here is that 70% of the states surveyed identify as a major role for their agencies a focus at the intersection of behavioral health and criminal justice. And this has gone up a lot in recent years. Next slide, please. So the Byrne Justice Assistance Grant Program is DOJ's cornerstone criminal justice funding to states and localities. It's small by SAMHSA standards, but it's really big in the DOJ world, about $350 million annually. And the hallmark of it is that it's very flexible, so it can be used across the justice system from prevention through reentry, and recently with a congressional focus on mental health and crisis intervention. Next slide, please. We're going to put in the chat a report that we did showing examples of how Byrne JAG is being invested across the states. And I won't dwell on this slide, but these are some examples of what Byrne JAG is funding in crisis-related initiatives and have been for a long time. Byrne JAG has often started these programs in the states, and you can see much more in the report that we've put in the chat. Next slide, please. So this is a busy slide. Don't need you to look at it particularly. You'll have it. But this shows the blue is Byrne JAG. The yellow line is other federal grants that the SAAs have authority over, and then the state funding that they have authority over. And we just love this slide because it shows the synergies of the federal and state money across the justice system, including in crisis, crime prevention, diversion to treatment, and other related programs. Next slide, please. So the program we particularly want to talk about is Byrne SCIP, the Byrne State Crisis Intervention Program, which was created by the Bipartisan Safer Communities Act with a particular focus, a sole focus on crisis. When Congress created it as a part of Byrne JAG, they also funded it specifically and additionally at $150 million a year for 5 years. Again, compared to healthcare, this is a small amount of money, but in the justice space, it's very meaningful, and it's solely focused on crisis, which is a game changer, we think, for the collaboration that can happen in the states between the behavioral health community and the criminal justice community. Next slide, please. I'm going to turn it to Matt because he's the SAA in Colorado, and he will be able to tell you a lot more about how that collaboration works. But I'm just going to fly through a couple of slides on the way to turning it to Matt. And these are examples of programs supported by Byrne SCIP in the state so far, and we're only in the first year. So we're really excited about how SAAs are investing this money, partnering with their mental health partners, and engaging with families and other advocates in the state. So you can see here community-based program, existing mobile crisis teams. You can see all that behavioral health liaison positions. Next slide. A lot in law enforcement. particularly around de-escalation training and further CIT programs, which they've always funded, but now they really have dedicated funding to be able to do that. Next slide. There's a particular focus in the Bipartisan Safer Communities Act related to this money around extreme risk protection orders. So for the states that have ERPO laws, they're allowed to use this money for that purpose, and we're seeing that happening. Some good work being done on ERPOs, particularly around public awareness. Next slide. I think this is the second to last one. Also, something that surprised us was a really heavy emphasis on juveniles and juvenile mental health and wellness in schools. And that is really exciting to us. And you can see examples here. And again, we're going to put a bigger document in the chat. And the last slide, please. No, this is the second to last. Also in corrections and firearm safety, a fair amount of emphasis on that. And then last slide is around assessment and research and a focus on program evaluation. So we're just thrilled about SCIP, and I want to turn it to Matt to talk about how this works in the States. So Matt.
Yeah, thank you, Elizabeth, and thank you to the folks on the call for being here and inviting us to talk today. If the term SAA is new to you, I've been in this role for 1 year. I came from a major city police department, and when we were going over my priorities, they said, oh, and you'll be able to tackle some of those uniquely in your role as the SAA for Colorado. And I thought, that's amazing. And I walked out to my car and I searched SAA Colorado and learned a new term that day. But definitely familiar with the work, definitely familiar with the funding, being in public safety for over 20 years. These two funding sources, along with a lot of the other BJA grants and the state level grants that Elizabeth touched on, are really important. And as she mentioned in the survey from our members, this intersectionality of the public safety space and mental health substance misuse is really increasing, and a lot of the SAAs are really engaged in this work across the country. And so if you don't know your SAA, I encourage you to look it up and start to build that relationship. SAAs in general are really good, I like to say, at three things: convening, educating, and expanding collaborations. Convening SAAs, this is kind of part of the fabric of being an SAA. With Byrne JAG and Byrne SCIP, there's a requirement for us to engage in outreach, and we have very diverse, in most cases, funding boards in our states to identify where to best allocate these funds consistent with the grant requirements and the unique needs of that particular state. And we're good at bringing together focus groups and having policy discussions really broadly with partners all across the public safety, education, mental health space. Educating, one thing we do in Colorado that I'm really proud of is we started developing these in-briefs, and some of them have significant overlap in this space about what works, where the research is at on this, and helping inform specifically our criminal justice partners so that they are aware of what's going on and what their partners around the state and around the country are working on. And then expanding collaborations. SAAs generally are very good at bringing folks together and having some of these difficult conversations and making sure that the right people are in the room, and then you can also build those networks. So when we're working on new programs or trying to expand resources, that we know who to call in our state and around the country. Colorado, our office is kind of uniquely positioned for success because we have such a diverse portfolio here in the Division of Criminal Justice. And what you'll find is in Colorado and in many states around the country, the role of the SAA is expanding significantly. We've seen that through the member survey over the years, and Elizabeth touched on this. In Colorado specifically, we have a long history of providing assistance to state and local agencies in the criminal justice system through policy work, conducting criminal justice research, supporting victims, improving services for those who are justice involved, and administering, as we said, federal and state level grants. For our federal and state grants, we actively work with our partners across the state to better prioritize our funding in certain program areas. So as many of you are aware, a lot of the federal and even state dollars, there's overlap in what can be funded for those projects. And so working with our partners across the state to better prioritize certain awards to certain programs is something that I think SAAs are really good at. A great example of this is just with the Byrne JAG and Byrne SCIP, because there is some overlap in what can be done in the behavioral health and alternative response space. We work with our funding board to better understand and prioritize certain awards to SCIP and allocate certain awards to the JAG fund. So we're making sure we're using all those dollars and we're using them as efficiently as possible. And you all know this, in order to affect change, we need to take a whole of community approach to these challenges. 988, mental health, alternative responses, substance use care. It's not just one system. We can't work in silos. And so your SAAs in your state can be a great resource for thinking globally about how we can support crisis services, behavioral health, and substance use treatment. And there's great need outside of these federal awards that we've talked about with Byrne JAG and Byrne SCIP. A lot of states, as we've said, have local level funding. Colorado passed a few years ago $7 million for a program called Multidisciplinary Crime Prevention and Crisis Intervention. It's a program we're really proud of. But when they first gave us the funds a couple years ago, we really had some difficulty building those relationships and bringing on new grantees. So we spent a lot of time doing outreach and trying to explain to folks the importance of building these collaborations across systems and how we can use this funding at both the state and the federal level to kind of braid funding to improve access to services. And then just last year, the state legislature here gave us another $3 million. And just to highlight the importance of this funding and the need for it in the community, we received over $16 million in requests for that $3 million that we were allocated by the state legislature. And I'm proud to say that 63% of all those funds over all the years have gone to nonprofit community-based organizations, and 80% of the awards have gone to agencies, nonprofits, governments in Southern Colorado and Western Colorado, which are agencies that tend to be a little bit more rural, have less access to care and services. And so really prioritizing those has been something that I've focused on in the year that I've been here. And SAAs are really good at ensuring that we don't build a bridge to nowhere. I come to this work coming from local government. I was an executive with the Denver Police Department and helped launch a lot of our alternative response programs. The STAR program is one that most people are familiar with. But really, and I take that view and apply it to my role as SAA in Colorado to better understand the complete landscape, to make sure that we're building programs like alternative responses, co-responders, mental health and substance use treatment, that we're building complete systems so that we can not only respond in a crisis, but we're able to hand people off, do a warm handoff, or we're able to set up systems for success in the long term. And then one last thing I want to touch on as I'm running out of time here is that it was in one of the slides, but it wasn't touched on. Most of the SAA offices also are home to the SACs, the Statistical Analysis Centers for the states. And so this is a really great resource for you all to think about too, to better understand the unique challenges and opportunities in your community. Our Office of Research and Statistics, just to give a couple of examples, used Connect and Protect grant funding to create a registry of alternative response programs across the state. This is really helpful in the 988 space so that everyone has access to those resources. That lives in the Colorado 911 Resource Center, if anyone wants to look that up. And then we've also worked with partners like the Behavioral Health Administration, which is the agency tasked with implementing 988 in Colorado, to best identify the training needs and SOPs necessary for transfers from our PSAPs to the 988 system. So with that, I will hit pause, and I think Elizabeth and I are happy to answer any questions.
That is really helpful and a nice start. And so a lot of us aren't really familiar with the acronyms and so forth. So you'll see in the chat, what does SAA stand for? And, you know, that kind of thing. But there are some questions. And just before we go to the roundtable, I just wanted to address a few of those. Let me see here. I think some were wondering, you know, can SCIP grant funding be used for hiring or paying non-law enforcement mobile crisis response teams? And Elizabeth, you said yes. Do you want to say anything more on that? Or is that just pretty straightforward?
No, no, I would just say that, again, remember the funding is small. SCIP is 150 million a year, which is a lot, but it's also, when you divide it between 56 states and territories, it's, a few million for a state. So it's not a lot of money, but a lot of states have been using either Byrne JAG or Byrne SCIP to test models of crisis response, co-responder models. We're seeing states wanting to use their SCIP money to expand what they've already done with their Byrne JAG money on these programs, expand it to another part of the state or just the increasing capacity. We do, as I mentioned, we are the TA provider, so we do a lot of TA around this to help states understand what impact they can make in that regard with this fairly limited amount of money. And we're seeing a lot of interest and engagement on it.
Yeah, and what I would just add from my perspective is, especially in Colorado, we use the funding a lot to braid multiple funding sources, or we use it to, as Elizabeth said, launch pilots and show proof of concept. And then throughout this process, we prioritize collaborations. We make it part of our applications here in Colorado for all of our funding sources, as well as a continuation of funding plan for them. So getting them thinking early on, if they are to get this award, this isn't dollars that are going to be here year after year in perpetuity. And so really planning for the future and working with their Board of County Commissioners, city councils, mayors on how we can build sustainable systems across the state.
That's great. I'm seeing it.
Can I just say one more thing about that, actually? Matt's point about proof of concept is a good one. On the criminal justice space, there can be a lot of fear that they're going to do something that's a little too outside the mainstream, that's a little too away from law enforcement. And we find that this federal grant money is able to test innovation in areas that maybe the state legislature isn't ready to fund, or that there isn't consensus around. So there is a lot of proof of concept activity with both of these programs.
Great. No, thank you so much. Let's go to the roundtable. And I believe Shannon Scully. Shannon, are you on?
I am.
Wonderful. So, Shannon, so delighted to have you on. Shannon is the Director of Justice Policy and Initiatives for NAMI. If you could just provide your perspective and anything you'd like to add, et cetera.
Yeah, I want to thank Elizabeth and Matt for being on. I have been partnering with NCJA and the SAAs for a number of years now, and I really want to emphasize their really important role in convening justice stakeholders within their states, and really being an entity that can convene people at the state level. And where this really kind of comes in and is really important is that as we think about crisis response as being justice diversion and criminal justice diversion for people with mental illness, I think it's really important that we continue to engage justice stakeholders for the people that might be falling through the cracks as we build this system. And so I think, from the SAA's perspective, having oversight and thoughtfulness and a view into who continues to end up in the criminal justice system, they can be a really strong partner there. I also really want to emphasize, because again, I've had the pleasure of interacting with a number of SAAs kind of through partnerships with our NAMI affiliates at the state level. And when Elizabeth says that when you've seen one SAA, you have seen one SAA, and they're so hungry for knowledge and ideas. They really do want to be helpful and good stewards of these dollars, and they are small, but I think that there's some really innovative and creative things that can be done, again, when we're educating them and partnering with them. And then just specifically with Byrne SCIP, I think presence of guns during a mental health crisis is always going to be a concern for our community, but those dollars were placed out there specifically as we look at the Bipartisan Safer Communities Act and some of the intent around it, there really was that intent that we would kind of address mental health crisis and where firearms come into contact with that. And so, I know that there have been some really great things. The SAA in Arizona leveraged some of those dollars specifically to put out public awareness about suicide by firearm. And I know we probably all know the stats here, but really the majority of deaths in this country by firearm are really happening with incidents of suicide. So I'm really appreciative that the SAAs and NCJA got introduced to this space, because I think as we talk about again, looping in everyone, building that table for making change. These are definitely a partner who are very interested in being part of the solutions and helping to kind of build out these systems kind of from where their little corner of the world is. So would really encourage people to kind of dig into some of the resources that Elizabeth has placed in the chat, because there's definitely opportunity there.
Great. Thank you so much, Shannon. I have one question for you. When we talk about the table, who should be at the table? There was a question that's related to the question I have, and that is housing at the table? Homelessness, housing, it's that social determinant that can really cause crisis, and so how is there a connection with housing?
Absolutely. I think, housing needs to be at the table along with criminal justice. And I think the more that we see states trying to grapple with, this emerging question about the intersection of homelessness and the criminal justice system, that'll be incredibly important to make sure that those stakeholders are talking, especially given that I think a lot of folks are really kind of questioning kind of that intersection of housing in the criminal justice system in the absence or kind of in the wake of the Supreme Court justice's ruling on Grants Pass v. Johnson. It wasn't, this whole of like, you are now allowed to incarcerate anyone who's homeless. It really kind of left that question open. And I think the more we are having conversations, again, between the crisis community, the housing community, the people who are trying to solve issues around criminal justice, we're going to be able to, as communities, put forth ideas where we are not relying on some of the traditional responses that come out of the criminal justice system and are really thinking innovatively. And I'll give in a small little pitch here. We do have a webinar next Wednesday where we're going to be talking about Grants Pass, what it means for criminal justice and mental illness and housing. And so would encourage everyone to sign up for that. I'll drop something in the link for folks who are interested.
Great. Thank you so much, Shannon. And want to bring in John Snook, who is Chief Policy Officer with the Meadows Mental Health Policy Institute. John, it's great to have you here. Please give us your perspective.
Thanks so much. And I will just start by saying it was a mistake to let Shannon go first, because she is always so smart and spot on with this stuff. And it is a hard act to follow. I know better than that. But I think Elizabeth and Matt and Shannon's points are all exactly right. And I think the big thing here to focus on is that both the Byrne JAG and the Byrne SCIP programs are really something of a skeleton key to unlock that door of how do we coordinate mental health resources with criminal justice resources, and how do we get those conversations happening at the same table. I think if you talk to law enforcement, they know Byrne JAG. They've known it for years. They understand that world. And when you can start to connect the two, I think it makes things really easy, particularly when you're talking about a program like Byrne SCIP that has a broad set of opportunities to really utilize, as Elizabeth was mentioning, to get beyond just the sort of typical, we're going to pay to, get some new police cars. Not that that's not important, but this gets us to a new place. And I wanted to add an example because I think it just really reiterates. So Meadows works, we're based out of Texas. We do a lot of work all across Texas. One place that's doing something really interesting with this is Round Rock. Round Rock's the second fastest growing city in the nation. It's just north of Austin. There is a ton of work that needs to be done on the mental health side, and there's a lot of successes happening. One of the things that Byrne SCIP is going to be used there for is to fund the emergency call centers to really train up the responders to understand both stated and then unstated mental health emergencies and mitigate bias in that decision-making process. And one of the things that we found all across the country is that moment in time, and as everyone knows with 988, that moment in time when we respond can really be the most important decision that's made within the entire process. And so moving away from just those sort of binary things of is the person violent or not violent, and then who do we send in those situations, to recognize some of those more nuanced and important decisions. There isn't a lot of funding that would obviously make sense to address that, but this Byrne SCIP funds can be something that makes that process a little easier to figure out how we're going to pay for it, and then it's just going to pay dividends down the line. I'm really excited to see what that's going to look like at Round Rock, and then how we're going to be able to use it across the state, because Texas has really done a nice job in trying to coordinate call centers and ensure that they're really the key driver in getting the right folks out to the right calls. And so the better we have them trained, the more we're able to utilize mental health resources whenever possible.
Wonderful. Thank you so much, John. And there are requests in the chat that if there's any way you could put some of the trainings in the chat box, if it's available that way, that would be wonderful. And also just want to note that Shannon Scully put, the webinar information in there. There are also chats in the chat box that really relate to those social determinants, what causes crisis, what stabilizes crisis. And so I just want to bring attention to those. I don't think we can address those in this conversation, but I do want to recognize that crisis is kind of the an indicator. I see it this way, as a systemic piece of social determinants of behavioral health funding, of housing, of criminal justice, of working together. It's a whole system that we work together to move forward. Thank you, John, so very much. Thank you, Shannon. And thank you, Elizabeth and Matt. You're doing great work. Thank you for the work you're doing, as Jeffrey just noted there. And let's move to the next segment. Oh, this is a treat. So Brandon Johnson is the subject matter expert at SAMHSA on suicide prevention. And as we mentioned earlier, September is Suicide Prevention Month. Brandon has presented at our NASHBID meetings. It's just a delight to have you on. Thank you. Please let us know your update.
Hello. Hopefully you all can see me. Oh, there we go.
Yes.
Can't see myself.
Except this says Belina Shaw. That's the only. We know you're Brandon Johnson.
Right.
Okay.
Yeah, I transported into Belina today. But hey, everyone, it's good to see you all. Happy Suicide Prevention Month. Just wanted to give an update on a ton of things really happening at SAMHSA. And I want to start with, and I'll put this in the chat after I'm done, but there is a new suicide prevention landing page on SAMHSA's website. If you've been to the old one, you probably know it needed a refresh. There were things that were kind of in different places. But what we've done is that we've been able to condense and put together a new website for suicide prevention on SAMHSA's page. And so I encourage folks, if you get an opportunity, again, I'm going to put the link in the chat, but it has new sections around risk factors and warning signs. In addition to that, it also has information on all of SAMHSA's grant programs around suicide prevention, including descriptions and also even some quotes from some of our grantees who have been impacted by the grants that we that we give out. And so if folks want to know more information about those, please go seek the website. Again, I'm going to mention it. I'm going to post the link after this report out. The other piece I wanted to mention is that within that page is an entire page on Suicide Prevention Month activities, but beyond that, materials for social media. So there's a social media toolkit for Suicide Prevention Month there. If you all follow SAMHSA or 988 or Dr. Delphin Rittman, you've probably seen some of our graphics. I don't know where my background went because I have a Suicide Prevention Month background. I don't know. Oh, it's because I'm probably on Belena's link. That's probably it. But we have a Suicide Prevention Month materials and things that you can use for virtual backgrounds. You can share on social media. There was one yesterday for World Suicide Prevention Day, but really to help promote and get the word out around Suicide Prevention Month, including even some language that you may be able to put in some social media sites. On top of that, there are a number of events that are taking place this month around Suicide Prevention Month. Yesterday, we had the honor of speaking on doing a joint webinar with ACF and SAMHSA and the Suicide Prevention Branch that was called Suicide Prevention Strategies for Organizations Working with Children, Youth, and Families. It was an amazing event, really well attended. There were over 1,000 people there, and it primarily was SAMHSA grantees, ACF grantees, and some grantees from some of our other HHS grant programs. And so we were excited about that. And I want to shout out the ACF for their partnership in having us do that together. I did want to mention an additional webinar that is taking place on September 25th. That is a suicide prevention webinar on Black youth suicide. So it's called Answering the Call, Empowering Communities to Prevent Suicide Among Black Youth. That is September 25th at 2 p.m. I'll put the link to that on our website in the chat as well if people want to update. I think we are almost at registration capacity. If we do, we're looking to see if there's a possibility for us to stream the webinar on SAMHSA's YouTube page, and you'll be able to get more information on our website about that as well. Also, I know 988 Day was mentioned at the beginning of this. We were just honored to be a part of that and to be able to promote using our materials from our Suicide Prevention Month efforts. And the NFL also released additional content for a conversation that I had around 988 with former NFL player Troy Vincent with the NFL. And so that's on NFL's Total Wellness page. And it's available for folks to take a look at that as well. So that's just a ton of what's happening for Suicide Prevention Month. That's not even all of it. There are more things happening, but I wanted to just kind of give you all those, and I'll put those links into the chat. And lastly, I just want to say just happy Suicide Prevention Month. The work that you all do is so critical to us being able to have impact across the country. We know that these positions can be high turnover, high stress, and you are working really on the ground to save lives. And I know sometimes it's hard to see that or kind of come to grips with that, but you all are, and you're doing this work so well that we're able to really share, to be able to share this message of hope for people across the country. And so on behalf of the Suicide Prevention Branch, on behalf of SAMHSA, thank you for the work that you continue to do day in and day out. And just know that we're a resource. If you ever need me or Belena, I'm going to throw her out there. Also, if you need us, please let us know. We're always around to help, and we always are around for feedback, and just grateful for our partnerships with the 988 office and also with NASHBID and other folks on this call. So with that, Megan, I'll turn it back over to you.
Thank you so much, Brandon. And that's so heartwarming for you to recognize everybody. I just want to emphasize the incredible work that you have done. You were integral to the national strategy on suicide prevention, and just bringing that all together You're the glue to all of this. And, just thank you for your incredible work and SAMHSA's incredible work. And thank you, Dr. Shaw, for having Brandon do this update today, because he's fabulous. So thank you. We are now going to move to the NASHBIT update, and Carrie Slatton-Hodges, I'll turn it over to you. And just want to thank you, Carrie, for all the work you do on CCBHCs and all the expertise you bring. Go ahead.
Thank you so much, Megan. It's a pleasure to be here. It was wonderful to hear about the opportunities around criminal justice and diversion and the intersections with mental health and addiction issues, and building those strong collaborations between agencies. We know that when we work together, we can do so much more. And so I'm really excited to hear about the partnerships that are ongoing and the work that is done in Colorado. I want to say a lot of times when we talk about criminal justice diversion and sequential intercept model, we think about adults. But I want to just put a reminder for us to be sure and remember, as we look at our systems and build our systems, the importance of partnering with our juvenile justice agencies, and that we are building our systems and our crisis systems with first and foremost in our mind of how we can help divert and support persons in receiving help and care without needing to touch the juvenile justice system. Now, I think we can all agree that tremendous work has been done as we've built the crisis system across the nation that really falls in intercept 0, and that preventing people from touching into the criminal justice system by having the appropriate resources available at times of crises. And in particular, the more that families and youth call 988 as opposed to 911, the more likely we are to be able to divert that crisis or issue away from juvenile justice and towards the path of appropriate treatment, whether that be for mental health, addiction, or family systems. So I really want to applaud the tremendous work that has been done, but to keep forefront in our minds that there is still plenty of collaboration and work that can be done to continue to support those youth and families that are in need, whether that be folks that are currently involved in juvenile justice and how we can partner together to give those family and youth the support they need, whether they're exiting from the juvenile justice system, or for that safe place to go. And although we've done a great job of really starting to stand up urgent recovery centers for adults along the way, developing those for youth and children is something that's critically important, that I think all of us are mapping now what that will look like in the future, and it will be such an important part of our system as we continue to grow in that direction. So that law enforcement always know that there is a quick, rapid place they can take a youth who is in need that then gets them back on their way, but then starts to meet the needs of that particular youth and family. But with that, I want to really mention some exciting things that are happening that can help others progress in those areas and in additional areas. And that is, it is our time of year where we start to look at and announce the transformation transfer initiatives. These are small grants that SAMHSA through CMHS comes to NASHBIT for us to lend out, to give out to states, along with support and technical assistance to do transformative work across the nation and be able then to share back that transformative work and what was learned amongst other states. So it's really a piloting kind of collaborative that is a share and share alike. And so much is learned each year from these initiatives that we're able to share and spread. It's so exciting. But I wanted to tell you some of the focuses this year that have to do with youth, in particular, community-based service approaches for justice-involved individuals with SMI or SED, which is exactly what we were talking about today. So there's a wonderful crossroads here with working with criminal justice and the new TTI that is coming out. So thank you so much. And that's all we have from Nashville today. But be sure and look for our announcements.
Carrie, thank you so much. And it's great. The TTI just does amazing work, and the Nashville team is remarkable. We are now going to move to Clayton Becker. This is amazing because I didn't know about Letters to Strangers until this piece. And Clayton, it is such an honor to have you on. I do want to just note Letters to Strangers, the mission, if you go to their website, letterstostrangers.org, the mission is Letters to Strangers, L2S, is the largest global youth-run nonprofit seeking to destigmatize mental illness and increase access to affordable, quality treatment, particularly for youth. I just thank you for your work, and we would love to know a summary about the Crisis Talk article.
Yeah, absolutely. Thank you, Megan. So yeah, as Megan said, I'm from Letters to Strangers. We're a youth-run, youth-focused mental health nonprofit. We operate both here in the United States as well as internationally. And our contention, or my contention, I suppose, in this op-ed is really quite simple. We treat physical health far differently in our schools than we treat mental health, just as we do sort of throughout society. And we think, quite simply, it's time for that to end. It is the expectation that students prioritize their physical health, that they stay home when they're sick, that they are given allowances when they have physical injuries that keep them home or illnesses that keep them home. It is the expectation that students will be taught about physical maladies, diet, exercise, injury prevention, drug and alcohol abuse prevention, but no such presumption, no such expectation exists for mental health. And we think that that is a problem. There is no reason, no good reason at least, why we shouldn't treat mental health as exactly the same when it comes to the sorts of allowances and accommodations that students are given in school. And there's absolutely no reason why we shouldn't teach about it. And as I note in the op-ed, and I think this is sort of the biggest problem we have, is school administrators in particular are often actively hostile to our efforts to bring mental health education into schools. To put it very bluntly, the administrators we've spoken with, many of them seem to be more concerned that they will be caught holding the bag of whatever potential liability they envision might exist if they talk about mental health, and then some student in their school or their district experiences harm as a result of a mental health crisis. They seem to believe, despite the lack of any empirical evidence, that talking about mental health makes mental health worse. And at Letters to Strangers, we fundamentally disagree with this presumption. There is no evidence to suggest that it is true. And in fact, quite a bit of evidence to suggest that talking about mental health, destigmatizing it, making it as normal as physical health has exactly the opposite effect. It has a protective effect on students' mental health resilience and their ability to manage mental health crises. So yeah, I know we're coming up on time here, so I won't take up too much more time, but that is the essential point of the article, is that it is time for us to stop treating mental health in our schools as something that's set aside, something that is separate from physical health, separate from our health education, and think of integrating it fully as just another part of managing people's health, managing students' health while they are in school, and as a necessary and concrete part of their educational journey.
Clayton, thank you so much. I want to just note that not only is Clayton with the Chief Learning Officer at Letters to Strangers, he is also a third-year PhD student at UCLA. So thank you for your incredible work and leadership. Let's move to the next segment, but thank you. And we have Vic Armstrong for Strong Talk. Is there music? Yes, no?
Yes,
Vic,
no.
are you on?
Okay. Thank you so much. As we think about and plan our activities, I'm sorry, something popped up on my screen. Wait a minute.
All right.
Can you still hear me?
I can hear you.
Okay. For some reason, my screen went black. Okay. As we think about and plan our activities for Suicide Prevention Month and beyond, we want to be mindful that our initiatives should be geared to support all communities. And whatever our outreach, it should be focused on creating access to resources, access to information, access to services. But access is not only about having physical proximity to traditional resources, it is about having resources available to me that are culturally relevant, relatable to my lived experience, and that I'm willing to utilize. Creating access, when done correctly, is about creating relationship. By definition, relationship is the way in which two or more concepts, objects, people, or groups are connected, or it's a state of being connected. There's power in relationship, power to create change. Relationship, by nature, breeds a sense of consciousness, shared consciousness with the communities that we serve, that conveys to them that what impacts you impacts me, and that we are in this fight together. Relationship based on respect for language and customs and beliefs creates an emotional connection that validates us as not only providers, advocates, and policymakers, but as trusted voices, and opens doors to educate those who are unaware about the impact of suicide and re-educate those who learn from inaccurate or misinformed sources. Relationship grants us the credibility to challenge communities, to fight for the historically marginalized, without blaming communities themselves for the structural exclusion, disenfranchisement, and flat-out neglect that has been visited upon them, often as a matter of policy. Relationship empowers us to call communities to action, to shift public perception and spread hope. Relationship encourages those with lived experience to share their stories of strength and perseverance. Relationship with communities assures them that if their loved ones experience a mental health emergency, they will find within our policies, within our resources, within our physical walls, a place of hope and healing, not a place of punishment and seclusion. Why? Because it is what I would want for someone who matters to me. Relationship is, in and of itself, a living reminder that no one should suffer in silence, and that those who are fighting the good fight against addiction, or those who live with mental health challenges, and those who experience suicidal thoughts will not be forgotten, will not be left to fend for themselves, but will be here tomorrow and every day after that. And that is Strong Talk.
Victor, thank you so much. You always give such powerful emphasis to what is really needed. And yes, relationships and connection is just right where it is, the center of it all. So thank you.
Thank you. Thank you.
So now for the next 2 weeks, when I learned in the green room what the next 2 weeks were, I was just so excited. We have the Kentucky 988 Marketing for LGBTQ+ and African Americans. Angela Roberts will be talking about that next week for episode 190. And the week after that, we have episode 191 for Warm Lines and Peer Support Lines as Allies with Howard Trachtman. these are very exciting pieces because I personally want to know so much more about these things, and especially about the warm lines and peer support lines as allies. That's amazing. So thank you, everybody. Thank you for watching. Have a great rest of your week, and we'll see you next week.